grandfather has Alzheimer's, and when that was kind of getting started, he had a lot of doctor's appointments, and there's a lot of medical jargon that people don't understand, and my family was kind of like bombarded with that a little bit. It's like, I can take care of that. I know what to do. I think it's like the privilege to be able to, kind of guide your family along that path. And I feel like that kind of fulfilling is like the role of almost like caregiver, even though you're not like the main caregiver, you're still kind of helping and adding to their care.
We're a 5-semester program, and we start in summer, fall, and winter semesters. So the first is really welcome to the world of nursing, and we kind of help them get to know how to do a good quality assessment. Second semester is medication, and this is when you start in the hospital. So right now they have psych, and then they'll have pharmacology. The next semester after that, they're in OB, and they have a medical surgical program where they learn about just your everyday patient in the hospital.
Currently, I'm interested mostly in the ED, so the emergency room. I'm hoping that's what I'll precept in. I do find nursing so fulfilling and rewarding, and I think that makes me more inclined to do the things that other people necessarily don't want to do. You really are seeing patients in their most vulnerable state. Whether they come in because it's a parent who has a child who, there's something going on with them, even if, they just have the flu or RSV, or you have a scared child and you have an extremely scared parent. And there's something I think really cool about, easing those fears, providing, education, because that's all really done in the ER.
Fourth semester is in a hospital again. We have continued med-surg classes, we do pediatrics, and then fifth semester, they're getting ready to graduate, so we have a preceptorship, which is a leadership component for a clinical, and they have to apply for it. Those who don't have a leadership, then will have regular clinical again.
People either think of like the big nursing, or they think of like the small, like doctor's office sort of things, and there's nothing in between. And I think Ferris does a good job of preparing us for like that whole scope. Big Rapids is a smaller community, so you get the like smaller town nursing aspect, and then you also get to go to like Grand Rapids and be in the really big hospitals, and you see a lot more. I feel like all of the professors kind of give you something different, not just like classes. You have some who have seen a lot of different things. They've all worked in different aspects of nursing, and so they all kind of bring something different to the table. I don't know, there's something about nursing where like you see so many different things and you get to learn from every single one of them. Like all my friends are always like, when I have something happen to me or my kids, I'm just gonna text you and ask. I don't know, that in itself I think is rewarding as well, not just like your actual job, but like the people can come to you and ask you those sorts of questions and you know what to say.